Hello everyone, welcome back once again on my channel. Are you new on this channel? Thank you so much for passing by. Are you old on this channel? Thank you so much for sticking around. I really appreciate. Have you subscribed? If you haven't subscribed, please subscribe to my channel, hit the notification bell. You will be notified every time I'll be uploading a new video. Give those videos a thumbs up and always comment. For those who don't know me, my name is Sandra, and on this channel we deal with health and beauty, especially women's health. So today, as you see on the title, we are talking about UTI, urinary tract infection. This infection is both in men and women, but it is 80% in women. So by the end of this topic, we are going to know why is it 80% prone to women. We are going to see the causes, we are going to see how we can treat it, and we are going to see how we can prevent it. Prevention is better than cure. So this channel is all about women's health. We as women, what can we do so that we can at least 70% prevent ourselves from getting UTI? So stay around, watch the video till the end. Let's start. UTI is an infection of the urinary system. And the urinary system is composed of the kidneys, the ureters, the bladder, and finally the urethra. So let's see a little bit how this system works. Let's start with the kidneys. The kidneys remove wastes from the blood and water. And this waste is the urine. So the ureters are connected to the kidneys. They transport that urine to take it to the bladder. There are those small cubes. They transport the urine to the bladder. And then the bladder is a sac-like structure that stores urine before it leaves the body. And finally, the urethra is that opening, the tube that connects to the outside of the body that helps us to remove the urine. That is when you want to pee, the urine passes through the urethra. So that is how the system works. Now, if this system is infected because of some habits, this is when you have UTI. So let's see, who is more likely to get UTI? Who is likely to get UTI? Everybody. Men, women, children, older people. But as I said before, it is 80% common in women. Why? It is because the tubes that carry urine in women is shorter. It is located, it is shorter, it is near the anus. And in the anus, it is where the E.COLI bacteria that causes UTI is common. So women are very prone to UTI because of that. So people with enlarged prostate, bladder prolapse, and those people who are diabetic, they are prone to UTI. So, what are the symptoms of UTI? When you see these symptoms, just know that you have UTI. You frequent urination at night. At night, you are always waking up to urinate. Even the frequent urination, like all the time you want to urinate. After 10 minutes, you want to go to the toilet, you want to go to the toilet. And when you go to pee, the urine is burning and it's very little. Just know that you have UTI. Also, the color of the urine. The color of the urine might be so yellow. That means that you have that infection. You get fever. The pressure on the pelvis. Incontinence, you can't hold the urine. Like even when you laugh, like you pee, like you can't hold the urine. You can't reach the toilet. The urine is just passing out. Just know that those are the symptoms of UTI. There is also pain in the side flank, that is the abdomen and the pelvis. But if you see these symptoms, please treat UTI as early as possible. Because if it goes beyond and it goes to the kidneys, this is when you are going to have kidney problems. You can even have kidney failure. When the kidneys are affected, this is out of control. This is so bad. You can treat the UTI when it's just here in the urethra, but don't allow it to reach the kidneys. That is, treat it as early as you see the signs. So it is treated with antibiotics, for example, amoxicillin, Cipro. But if you see that it is frequently coming back, like every after the other month, this month you are having UTI, you treat it. The next month, after 2 months, it comes back. That means that you are not going to use antibiotics again. The doctor will switch you to another treatment as early as possible. So this is where our interest is. So we've known what brings about the UTI, what are the symptoms, what are the causes. So right now we are going to see how we women can prevent this UTI. At least 50%. How do we prevent this UTI? We do things in life, mistakes, maybe we don't know, but when they really injure our health. So we as women, we have to take care of ourselves to prevent certain things. Yes. So let's see how we can prevent, even when you're at home, you prevent yourself from UTI. And number one is practicing good hygiene. In every videos of mine, go practicing a good hygiene. It's very crucial in women. It prevents a lot of things. So in this topic of UTI, we are going to see why do we need this? We need it so bad. As I told you earlier, the woman anatomy is shorter than in men. The urethra is very near the anus. So it is very easy for the E.COLI bacteria to move from the rectum to the urethra. So how do you prevent this? Always wipe from the front to the back. Don't wipe from the anus to the front, because we don't need the bacteria from the anus to enter the vagina or to touch the urethra, because they are very near. Always wipe well. I don't know. This might look very, very easy, but it know how to wipe. Like even the children when they are young, teach them how to wipe after they use the toilet. It is a very big mistake. This is number one, getting the UTI. The E.COLI bacteria will move from the rectum to the urethra. Always wipe from the vagina to the anus. Simple as that. Good hygiene practices. So good hygiene during menstruation. When you're menstruating, please always change your pads and the tampons. Yes, this is where the infections will enter the urethra. The urethra is just open like this. It's not closed. It doesn't have doors that it will close itself. No, it is just open. So whatever mistake, the bad hygiene you put down there, it will always affect the urethra. So always change the pads and the tampon frequently. Don't stay in the pad for the whole day. No. Remove the tampon frequently and always change your pads. Number 2 is drinking a lot of water, a lot of fluids. How does it help? It helps to remove infections from the urinary tract. So the more you drink water, the more you pee. So the more you pee, the more you remove the bacteria from the urinary tract. So that is why it is recommended that a person should drink 8 glasses of water a day. It will help you to flush out the toxins from the body. So instead of the infection to sit in the bladder, it will be flushed out because of this frequent urination. And you will not urinate without water. You will only urinate when you drink enough water. So always drink enough water. Water is life. Water is good for the skin. Water is good for detoxifying the body. And now see, it removes the infection from the urinary tract. Why not? A lot of water all the time. Water, water, water. The third one is peeing after sex. I talked about it in my video. I'm going to put the links in my bio about a healthy vagina. Yes, because we don't want to keep bacteria in this place. I talked about peeing after sex because of throbbing, like those people enjoy throbbing. So some bacteria might have entered the urethra during sexual intercourse. So immediately after sex, go and pee. It will help you to flush out the bacteria that might have entered during the throbbing. So it is very crucial to take water. You can't pee without water. Always stay hydrated. You have a healthy vagina. After sex, you will have to pee. Always pee after sex. From there, don't stay there. No, go and pee. Pee out all the bacteria that might have entered. Another thing is clothing. Under clothing, I mean wearing breathable clothes. Don't wear tight clothes. Don't stay in wet clothes. Like after swimming, immediately remove the wet clothes. Don't wear wet underwears. Always make sure that the valve is dry. Don't leave the valve wet. What are we preventing? We are preventing the bacteria that would have piled up around the urethra. So we have to keep that part clean so that the bacteria doesn't enter the urethra. In this way, we can prevent UTI. And then always avoid unscented products. Unscented products, I'm talking about the bubble baths. We want to soak ourselves in bubble bath, but it's not good. These things are packed with a lot of chemicals that might enter the urethra. Okay, the perfumes, the powders, everything. I told you the vagina needs water. It needs water. And I told you only on the valve we use mild soap because some people have a bad skin where they need to put at least cream or like in the groins. Maybe they are peeling, maybe they are so dry and they need that oil. So we use the soap, we clean it well with the mild soap, and then we put the cream. So those people can, and that is only on the valve. And make sure that if you are using the mild soap to clean the valve, use a lot of water. If you are using, if the percentage must be like, if you are using 10% the mild soap, you use 90% water. Don't put anything inside your vagina or your urethra. Use a lot of water. Yes, to avoid the chemicals that would have been in the scented products to enter the urethra or the vagina. Yes, so in this manner, you would have prevented UTI at least on some percentage. And do not dodge. We are talking about dodging. Dodging everywhere. I think dodging is a very big problem. I don't even think, but it is what it is. Dodging is very bad. Why? Because it removes it removes both the good and the bad bacteria in the vagina. So what is left to protect your vagina? To protect the downer part. It's not good to dodge. Avoid dodging. Don't put anything there. So those people don't know about dodging. Dodging is where some fluid is inserted into the vagina to wash it. No, the vagina has a capacity to clean itself. The vagina cleans itself through discharging some fluids, just cleaning itself. When you are menstruating, it has a lot of things. It produces a lot of things to clean itself. So you don't need to dodge. When you dodge, you are calling for infections. Stop. Another thing, we have birth control pills. Birth control pills can bring you about these infections. So always check with your doctor what is a good birth control pill to go with. Especially the hormonal birth control pills are so bad. That's why women on birth control pills are prone to UTI. So please always go and visit your gynecologist and change the birth control pills. Yeah. And then lastly is a good diet. Remember, health starts from the inside. Health starts from the inside. When the inside is good, it gives out a good outside. Yes, health starts from the inside. So always get a good diet. There are those foods that are good for the vagina, like cranberries. Cranberries are said to treat UTI. They treat diseases. When you take cranberries all the time, you don't have problems with the vagina. We have yogurt. People even go ahead to wash the vagina with yogurt. They put it for 5 minutes and then they wash it out. And then the same thing when you eat it, we have fermented foods like yogurt, we have kefir, and then we have miso. All of those are fermented foods, good for the vagina. Why are they good? They add good bacteria to the vagina. They bring it back. They create that good bacteria for the vagina. So always eat well. Don't eat to fill your stomach. Eat what is right at the right moment. Treat the disease as you are eating well. We also have water. This is we can put this in the category of food. Drink enough water to help you flush out the toxins. Herbal teas, green tea, chamomile, whatever. Green tea is also good for the body. It flushes out the toxins, and all the time they are flushed out. You know, the bacteria doesn't have a room to grow. Even if it's there, it will be flushed out. That's why you might feel sick today, something is inchy like that, and then after it will disappear because it is flushed out. Flush it out with water, herbal teas, take yogurt, drink those juices. Always look for the specific food for the specific disease. Find out. I'm here for you. The channel is here. What are you waiting to subscribe? If you haven't subscribed, please subscribe. Hit the notification bell and comment. You can ask me, people are asking me. So, talking about UTI, I had a lot of messages about UTI. And so, why don't we talk about it? So, I'm here, we talked about it. So now we know. We are here to know what causes things. How can we keep ourselves clean? Prevention is better than cure. I didn't talk about some of the risks of getting UTI. Like women anatomy, as I told you, we are very prone to UTI because the urinary system is near the anus. Abnormalities, like those abnormalities, people who use catheters, urinary procedures in the past, sexual activities, these all factors are prone to UTI. But always the key here is to know the symptoms, the signs, and always rush to the doctor immediately, and let's try to prevent it. Okay, thank you for listening till the end. I love you so much. Please subscribe, comment, give my video the thumbs up, and always tell me what to talk about. You are always welcome. Once again, my name is Kabia Sandra, and on this channel we deal with health and beauty, especially women's health. See you in the next video. Bye.